We are starting it off with some breaking news from D.C. on health reform. Some unexpected indications tonight that by this time tomorrow, we will know if there's going to be a public option for health care. We will know if Americans will have the choice of a government-run public insurance plan alongside the private insurance we can choose now. Many Americans believe that adding a public option to the mix of choices we've got on health care is the only way health reform will really reform anything. Although the public option has been proclaimed dead many a time over the course of this debate, we have learned that it is actually very much still alive, and in fact, tomorrow, 2 amendments for a public option will be presented before the Senate Finance Committee. Democratic Senators Jay Rockefeller and Charles Schumer announcing this evening that they will demand a roll call vote on those proposals. What does that mean? It means that tomorrow's the judgment day. It's time for senators to pick sides. Joining us now, just out of the Finance Committee hearing room, is the senior senator from the state of New York, Charles Schumer. Senator Schumer, thank you so much for helping us break this story. Thanks for joining us.
Good evening, Rachel.
What's going to happen tomorrow in your committee with these public option amendments?
Well, tomorrow is really the first day of the fight. It won't be the last. We are going to offer Senator Rockefeller and myself 2 public option amendments and have the Finance Committee vote. Your viewers should know that this is the beginning of the fight because the Finance Committee is more conservative than the Senate as a whole. The Finance Democrats tend to come from rural and redder states. We'll then move to the floor of the Senate, where the public option has a better chance than in the Finance Committee, and then we'll move to Conference Committee with the House, where it has a better chance still because the House has been very strong. And my prediction is that at the end of the day, we will have some form of public option, and a good form of public option, in the final bill. Tomorrow's fight, to be honest with you, is uphill given the membership of the Finance Committee, but we want to start the debate because the more the public hears what the public option really is, the more they like it.
Why do you think that getting senators in the Finance Committee on the record starting tomorrow on the public option is a first step toward getting one in the final bill? Do you think people voting right now is the best strategy?
Well, we do, because the way the public option is snuffed, we all know the insurance industry doesn't like it. It brings real competition to them in a way that no one else does. Right now, in most markets, you have 2 or 3 insurance companies and nobody else. And the public option, not having to make a profit, that's about 10-12% of the income, not having to do all this advertising and merchandising, that's another 10 to 20% of the income, will have a real advantage. But the public doesn't know it. Propaganda from the right and from the insurance industries has convinced people they're going to be forced to get rid of their present health care and go to, quote, a government plan. It's an option, and you have the option to go to a public option. Even if you stay in a private insurance and you prefer that, the public option will make it better because it'll force the insurance companies to bring the cost down. And so by having this discussion with the nation's eyes focused on the Finance Committee and on the debate, we're going to win this fight. If we were just do one vote at the end of the day, the insurance industry would probably be able to snuff it out. But you keep doing it, building up support, we have a good chance of winning.
Your public option bill and Senator Rockefeller's public option bill are different. They're both for the public option, but they have different approaches. Will you vote for both amendments?
Yes, I will. Senator Rockefeller's is stronger. It's more like Medicare. I would prefer it, frankly. But my amendment, called the level playing field option, is the one that probably has the chance of winning tomorrow in the Finance Committee and elsewhere. And if we were to get a public option in the Finance Committee, as I said, it's an uphill but hardly a forlorn or lost fight. That would guarantee that there'd be a public option in the final bill because of the 5 committees that have dealt with health care, 4 have put public options in their bill.
So since you're the senator from New York, I can make this lame joke, but if it can make it there, it can make it anywhere.
You betcha.
One last question for you. If at the end of the day, what does get voted on, what you're voting on with the full Senate, is a health reform bill that doesn't contain a public option, will you say now that you'd vote against that? That would do a lot to add pressure to the to the forces that want to that want a public option in the bill.
Right. Well, those of us who are in the lead on health care have decided we're not going to draw a line in the sand, but we're certainly not going to say we will vote for a bill without a public option. We're fighting hard for the public option. Obviously, you have to look at the overall bill. What are the affordability provisions? How does it treat middle-class workers? How does it treat the states with Medicaid? How does it treat children? And make an overall judgment. But public option will be very important to me in deciding whether to vote for final passage.
And we'll know a lot more about whether that's going to happen based on what starts tomorrow. Senator Chuck Schumer, thank you for your time tonight.
Thanks,
I know
Rachel.
you're very busy right now.
Cheers. Right. Bye-bye.
The Republicans are a very, 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 very small minority in both the House and the Senate right now. And that is why it is ultimately Democrats, liberal, moderate, and conservative Democrats, who will decide what kind of health reform we get, or if we get it at all. Learning tomorrow who's going to be on record in favor of these various types of the public option will be a big part of knowing what Democrats are ultimately going to come up with. But that is not stopping Republicans from trying to stop the whole health care reform process altogether. And the way they're trying to stop the process is by slowing the process down so much that it just dies from sheer boredom or exhaustion. Consider the 564 amendments that have been filed on just this one version of the bill in just one committee. 564 amendments that all have to be discussed and voted on. How long will that take? Well, here's a sense of how the pacing was going as of yesterday.
Voted on, I think, about 25 amendments. And I look forward to an even more productive day.
At 25 amendments per day for 564 amendments, 23 workdays to vote on all of them? And if today's the third day of hearings, 5 workdays in a week, 30 days, half September, at this pace, I think this thing doesn't get voted on until October 26th for just this one bill in just this one committee, if they keep up this pace. And that, of course, is exactly the point. Opponents of reform are gung-ho about waiting.
We need to slow down and get this right. We need to give the members of Congress the time they need to understand what they're going to be voting on.
The reasoning for slowing it down is that in Washington, the way you kill a bill is to slow walk it. And Democrats know that.
$100 billion. Mr. Chairman, let me just complete my thought here.
In about 1 minute, you'll complete your thought. Okay, we got to.
I'll complete my thought and then make another point, Mr. Chairman.
This is your delaying, Senator, and we just have to move on.
Mr. Chairman, I am not delaying. I'm making an extremely important point.
It's a very, very important point, but you're also delaying.
The very, very, very important point is that the Republicans are delaying. That's their tactic, full stop. Let's see if the Democrats can pick up the pace. We'll be right back.